Hey everyone, welcome. Thanks for joining me today. I am here with Commissioner Dean Karski from Minnehaha County, and we're here to have a conversation about a facility that's going to be opening next year called The Link. And Dean, thanks for joining me today. I'm going to call you Dean, not Commissioner.
Perfect.
You call me Paul and not Mayor. How about that? Deal?
No.
Okay. Well, so first off, I want to kind of give those watching a little bit of overview of what The Link is. You've maybe heard about that. You maybe also heard it called the Community Triage Center, which we referred to it as for a long time. The Link really came about as a partnership with Minnehaha County, Sanford Health, Avera Health, trying to figure out a way where we can help people experiencing chemical dependency issues, behavioral health challenges that a lot of times we would find in our incarceration system, in our prison system, and say, hey, is there a better way to be treating these folks that are experiencing these issues? So for many years now, longer than I've been mayor, this has been researched, and we've looked at a lot of different ways to open potentially a facility that would do this. And it's finally coming to fruition. In 2021, we'll be opening this thing. And so we'll talk a little bit about how it will work and what it will look like and so forth. But Dean, you've been involved in this longer than I have. This has probably been 6-7 years maybe in the making and discussion, but maybe what's your history on the project and how it came together?
About 4 years ago when I came on the county commission is when I was basically placed on the triage center team. But in reality, the discussion has been going on since like 2011. Our human services, the sheriff, and numerous other people from the hospitals have been discussing how to best serve the population that has mental health, substance use disorders, and that are basically chronic users of our system, of the services that we provide. How can we best take care of those people? The county has been providing detox services for at least 30 years, as far back as I can find. And we're talking about two things here. We're talking about detox and sobering. What's the difference? Detox is when we bring that person in off the street, maybe law enforcement, maybe the ambulance drivers, whatever, that this person is incapable of taking care of themselves because of some level of intoxication, drugs, alcohol, etc. So we got to get them sober. That can take a few hours to maybe 8-10 hours. Now they're sober, and I did that backwards. Sobering is when we bring them in, and detoxifying them is once we get them sober. We want them to be able to, if they're ready, willing, and able to go through a program where they can detox from the drugs or alcohol that they're on and try to lead a normal life is where we want to get them to. So,
and an important point on that, though, is that, and this is really relevant now to this COVID world we're living in, there are times when our hospital ERs are being used for some of those services. So someone is high on drugs, they're chemically dependent, they're intoxicated. It's not an incarceration issue, so they get taken to the ER and they use up an ER bed, they use up ER staff, when really it's like, should this be is this a healthcare issue, or is there an underlying root cause of that? So I know that's been a reason our healthcare partners have wanted to be involved with this.
And taking them to the emergency room is the most expensive way to treat them. And a lot of times this population with these problems don't have health insurance. Right. So what we're doing is we're taking care of them socially through tax dollars and et cetera. So we're trying to figure out the most efficient, effective way to take care of these people. So the important thing is our triage center is a safe place to go if you are in this circumstance. And if you've ever been to our current facility, it does the job, but it's a dismal place. Right. You probably would not want to take a loved one there to get sober or to go through detox because, let's face it, it's a jail-like setting because it was a jail. And we're trying to find a better place to put people that they're willing to come to. And we're not talking the Hilton, we're talking a very austere setting that we can get people treated properly.
Mm-hmm. Even coming up with the name, The Link, there was an intentionality to that too, in that we don't want this to sound like some bureaucratic government facility. We kicked around different names and ultimately decided on the link, really because this facility will be a link between problems, whether that be addiction or behavioral health issues or whatever they are, and treatment, help, and hopefully recovery in that case. So we talked a little bit about the addiction and substance abuse side of things, but the other way that the link will serve our community is through behavioral health challenges. And you want to speak a little bit about that and the need for that?
And one of the things I quickly learned when I came into this role is that substance use disorders and mental health, there's a huge overlap. Mm-hmm. Well over half the people that have substance use problems also have mental health issues. And therein is part of the problem, because it's not just a single thing we're trying to treat. It's twofold, and sometimes even more than that. So where we're trying to put the people and give them that handoff, like you said, first of all, we got to make sure that they're ready, willing, and able to get to that next level. And if they're not, well, we got to make sure that they're not a harm to themselves or mm-hmm. society. Being drunk in itself or intoxicated is not illegal. So we can't put people in jail just because they're intoxicated. But we do have to have some form of societal help for them so that they aren't a danger to themselves or somebody else.
Right, yeah, for sure. And a few data points I have in front of me here. Over a third of our residents, through surveys and data that we've collected, have been diagnosed with some form of depression. And that same percentage say they have engaged in some sort of binge drinking at some point in their life. Like, those are really high numbers. And it reinforces the need for a facility like this. We're probably, in my opinion, a decade past needing this. I think one of the concerns I know that you and I have discussed before is that this facility, the day we open the doors, will be very busy. And unlike a for-profit business, we don't want it to be busy, but it will be busy. And so maybe let's talk a little bit about the location of this, the great facility that we have, how we'll be able to expand. And, for the people listening, this is going to be at 8th and Dakota. So used to be Falls Community Health was in that building. You remember that probably from your council days, Falls Community Health. And the city vacated that building for this purpose, and we'll be occupying the first floor of that for the triage center. But what are we going to do if we run out of space? I mean, I know we've had those conversations. If this is, quote unquote, too successful, what do we do from here?
Well, first of all, Mayor, kudos to you. And when you came into office, you said, hey, I know this thing is ready, but the where part is the issue. And you volunteered and worked with the city council to get us into that building. Thank you very much for that, because it's truly the perfect location. And yes, we're building it to take care of our current need, but we have a whole second floor that we can expand into if we need to, whether it be detox or sobering, that type of thing. This is 24/7, 365. Nobody ever knows, like you said, a third of the people that are in this situation probably are just struggling with depression. But what's going to send a person off the rails? You don't know. Could it be COVID? Could it be another family issue? What causes them to start to turn to alcohol, drugs, or whatever? And redirecting that person back from where they were as a productive member of our society, a family breadwinner, etc. That's the important thing.
Talk a little bit about who's going to run this thing, because there's four primary partners. There's the city, Minnehaha County, Sanford Health, and Avera, which, by the way, getting all those four and all their different bylaws and entities to get to yes on this thing is a feat in and of itself. So yes. Thank you. I mean, that's a partnership that this city has really never seen before. So that's been good. But who's going to run this? Is the city in charge of this? Maybe speak to that a little bit.
Well, the important thing from my perspective when I started with this was that there really was no ownership by any government entity. And that's what we've done. We've set it up where the city, the county, Avera, Sanford all came together and said, we're equal partners in this, because we all have an equal share in what needs to get done here. So everybody's come to the table financially, and we are hiring we basically did an RFP and asked for companies to submit proposals to run our triage center. We did that with the help of Steve Lindquist, who's got a very extensive background in the mental health and issue areas, and he basically, for almost nothing, agreed to come in and help us to get this done. In fact, when I say almost nothing, I don't think we've paid him yet. Thank you very much to Mr. Lindquist.
He's been deferring his bill, which has been incredible.
Yes, and he has just been a godsend to get things done so that we can move our program forward, because the fact that nobody truly owned it, there's nobody really in the driver's seat. So we hired Steve to come into the driver's seat. Let's look at a contract. We've hired attorneys so that everybody feels comfortable with the program. And are we safe to say who's got the contract?
We better not, because it's not inked, but we're at the goal line, right? We're at the
We
goal
are right
line with
there.
the provider.
Yes.
Yeah.
So we know who we believe is going to take it over, and it's going to be run by a company, and they're going to have a separate contract to run our triage center. So it's not going to be owned by the city, the county. It's a separate contract in itself.
Well, and I think being, palms up with the public on this thing, it's about a $1.6 to $1.8 million annual operating cost for this. It's being split evenly amongst the city, the county, Sanford and Avera. So we're all kind of pitching into this deal. I often have a lot of people reach out to my office who want to help because they've been impacted by addiction, or their son or their daughter or their spouse or whatever, or behavioral health challenges. And they're like, where can I help in the community? Where can I serve? Well, this is going to be a place now, if people want to give financial support, we will always welcome that, because let me tell you, this thing isn't a revenue generator for the city or the county or anyone else. I look at this as like a park. It costs us money to provide this service to help people's quality of life in our community. It's not going to make us any money, and so we've had to find money, I know, in our budgets to do that, but the Helmsley Charitable Trust has been a huge blessing. They gave us a very large contribution of $500,000 to help with this project, and that's really given us some breathing room with our build-out costs and so forth.
Exactly, and as you said, our community in itself is very giving, and a lot of people have been through the crisis of mental health and addiction issues with family members, and maybe they got them through it, or maybe it didn't end the way they wanted it to, but they want to help other people, and they're willing to step up to the table. And through the Sioux Falls Community Foundation, thank you. They're able to give, because this is a nonprofit, and they're able to give so that they can help our community, help other people maybe in things that they've been through. Sands Drywall would probably be a great example of a local business that is willing to help us out with the construction, just because Mr. Sands, Greg Sands, has been through those issues, and he understands the critical need for making this work.
That's another great example. Sands Drywall is doing a lot of this work for us with no margin. They just want to give back to the community. MSA Architects, Lloyd Companies, we just had some great partners that are all stepping up to help with this project. So we're about out of time, so I think we got to wrap it up. But you'll see more videos here on CityLink and online about the link. We're talking with providers and talking with other experts in our community about addiction and behavioral health challenges and why this facility is so important right now. So I'd ask that you watch our social media channels for updates. We're excited to announce that the link, we now have our own website, which you can go visit at linksf.org if you want to learn more about the facility. So Dean, thanks for joining me today to kind of wrap about the link, and I look forward to early next year we can cut a ribbon on this thing and start serving our community.
Thank you, Mayor, for your leadership. This has been great.
Thank you,
You've really helped us get going.
Thanks, man. Thanks, guys.